We've been talking about pharmacovigilance for a while now, and we've made several videos on pharmacovigilance. I would say that the concept of pharmacovigilance is basically you trying to observe drugs that has already been in circulation, drugs that has already been approved for marketing, all right? But you are still observing this drug to see if some individuals in the society are reacting differently to these drugs, right? So you're trying to actually check out for the adverse drug reactions, right? In drugs that has already been termed safe. And we made examples to say that you could make a drug and you could do an experiment with 100 people. Now, these 100 people are not the total number of people in the society. So even as much as you made this experiment with 100 people and you got a positive result, when you put this drug out in the society, this drug can have adverse effect, okay? So now looking at the signal in pharmacovigilance. Signal in pharmacovigilance. A signal in pharmacovigilance simply refers to the first alert about the problem and hazards with a drug. Okay, that's a drug that has already been termed safe, but when you put it out in the general population and they are using it, you get to see that okay, there are problems with these drugs actually. All right, so that first alert is what we call signaling in pharmacovigilance. So it can be generated through the doctors, nurses, dentists, or pharmacists in the field. Okay, it could be that the patient actually told the doctor that, doctor, when I take this drug, it's like this, it's like this. You note it. Another patient used to tell you when I take these drugs like this, right? So that's basically the signals that we're talking about. So the signal is the report information on the possible causal relationship between an adverse drug effect. Okay, you're trying to actually look out for adverse drug effect, right? So signal can also be called communicate. Okay, communicate or communication. Basically, you're trying to actually tell the doctor that this drug is working for other people, but for me, it is not working for me, right? So you're actually looking out for the relationship between the adverse drug effect and a drug, okay? So that's basically the relation between the unknown or incompletely documented drug, okay? So guys, more than one signal reported is needed to generate a signal, all right? So basically, if one patient complains, you wait for another patient complains, like 5 patients complaining, then you know that it's a problem, okay? And it also depends on the seriousness of the adverse drug effect and the overall quality of the information, all right? So it could be that, okay, this drug is simply not making me to sleep quick. That's not really a good reason enough to withdraw a drug that is saving people from a viral infection. Do you understand? Because the infection will go and you stop taking the drug and your life will go back to normal. All right. So it has to be a serious reason and the information has to be of quality before a drug is withdrawn from the market. Right. You guys, that's it about understanding signal in pharmacovigilance. Right. That's it and bye for now.